I've been very fortunate in the past year to be the project manager for something that's been funded by the National Library of Medicine and National Institute of Health, focused on the opiate healthcare crisis. We know that 130 Americans lose their life every day to an opiate overdose. And in the past 20 years, over 450,000 Americans have died from an opiate overdose. When you look at the numbers published by the Health and Human Service Department of the federal government, they're staggering. 10 million people abuse prescriptions every year in America. Over 2.5 million Americans suffer from an opiate use disorder. And what's behind the numbers is even more disturbing. The grief, the guilt, the loss, the pain of the families and loved ones that continue on afterwards. We are an outlier as a country. We consume 80% of the world's opiate prescriptions, less than 5% of the population, the world's population. We really stand out. Some studies indicate that 1 out of 3 American adults receive an opiate prescription. Vast overprescribing. No other country comes even close. And despite that, healthcare providers, even through today, continue to overprescribe. 2018, the Mayo Clinic published a study that said opiate prescriptions have basically remained flat over the last couple of years. The CDC indicates they've come down slightly to about 190 million opiate prescriptions, or about 58 per 100, but still far too many. And ironically, many opiate prescriptions are not used either partially or fully. Study after study shows that this overprescribing is totally unnecessary. Johns Hopkins said 74% of their surgery patients did not use all or any of the opiates that were prescribed, but only 9% of them actually disposed of them properly. Study after study. Mayo Clinic, 2018, 63% of their surgical patients who received opiates didn't use them, either partially or fully, and only 8% of them disposed of them. National Institute of Drug Abuse, 7 out of 10 opiate prescriptions are not used fully or at all, consistent with the study done from the University of Michigan, published in JAMA Surgery. Study after study. Older Americans, what do they do with their leftover opiate medications? Generally, they hold on to them. Only about 9% actually dispose of them. So what this creates is diversion, misuse, and what follows, we know, is the heartbreak and the misery. Healthcare providers have an important role to play here. They have to nudge people to get rid of the unused prescriptions. We know that 1 out of 4 teenagers is going to experiment with drugs. And we also learned that in more than 50% of the cases, up to 65%, that teenagers actually find those prescription opiates very easily in their parents' or grandparents' medicine chests. So don't make those available to those you love. Prevent the diversion, because opiate dependence can happen very quickly. Some studies indicate after 5 days, there are many people who struggle stopping. And some, their life has changed forever. So do it now. If you have unused prescriptions in your home, please remove them. There's 4 simple interventions that you can do. One is that you can participate in your community's drug take-back event. Often happen on an annual basis, sometimes more frequently. A second is to go to a drop box at a police station or a local pharmacy, if they have one. It's a drop box that's locked, it's anonymous, easy to use, or follow the FDA recommendations of crushing and mixing them with something that's distasteful. Or you can buy one of the 8 at-home drug deactivation disposal kits that have come on the market recently to help with this problem. They're all simple and safe ways to dispose of unused medication. So let me talk about the pilot project that's been funded. We've conducted a communication, education, and distribution of campaign information packets and drug disposal kits to a variety of stakeholders, who in turn have provided them to community members across more than 50 communities in Massachusetts, Rhode Island, and New Hampshire. These include healthcare providers, law enforcement, public health, hospice groups, senior groups, nonprofits, student organizations have all been. Again, I want to acknowledge the National Library of Medicine and the National Institute of Health for making this possible. Without their funding, we couldn't have done any of this. And we've engaged over 50 organizations. We've provided more than 12,000 drug disposal packets and communication packets. We've done press releases, forums, social media, appeared on community television. So it's been a widespread and widely accepted, enthusiastically accepted campaign where people have actually asked for more packets, more information packets. And I want to really thank some key contributors: Chief Bongiano, Dr. Baravel, D.A. Ryan, public health official DSIC. They opened so many doors in so many communities to make this possible. Here's our campaign literature. Very simple, but it resonated with people because it struck a chord. A simple intervention. Just dispose of things. And we gave them an at-home drug disposal packet and method to do it. So if they didn't want to go to a drug disposal site or a drug take-back day, 70% of the people who responded said they disposed of 15 or more prescription pills. 60% said that they had previously kept the unused pills at home. So, as I mentioned, we had press releases in concert with law enforcement officials, public health officials, healthcare providers. We appeared on local television shows. We went to a number of community forums to discuss the importance of cleaning your house of unused and unneeded opiate prescriptions and other dangerous medications. And student organizations in Massachusetts, Rhode Island, and New Hampshire were very active in helping us with this, with their family, their friends, and others. So the next step was to complete a study that we started at Newton Wellesley Hospital that got interrupted by COVID-19, complete a manuscript, and then continue to advocate and distribute information to people. So I want to thank Susan Halpin, the National Library of Medicine, the key contributors, the 50-plus participating organizations, and the students at MCPHS and University of Rhode Island. So questions about this project or how to dispose of unused medications, please feel free to contact me. Here's my contact information, email and cell phone. I hope that you'll, at this point, go to your medicine chest and see if there's anything that might be lurking, because you might just save one person.